In Health Minister Christian Dubé's reform of the public healthcare system, the creation of Santé Québec is fundamental. But what it is exactly and what will it change for patients?
The quality that we were looking for is leadership.
Santé Québec is a crown corporation like Hydro-Québec. It will be run by some 900 employees. In Quebec City, they'll be working in this health ministry building. Its first CEO, Geneviève Biron, an entrepreneur in private healthcare, has a 3-year mandate. Its 15-member board of directors is also headed by a businesswoman, Christiane Germain, former co-president of a hotel chain. Santé Québec will manage the province's health facilities and become its biggest employer, with about 350,000 workers. Its main mission: improving access to services, reducing wait lists for surgery, and wait times in ERs.
Those have been the exact same objectives for the last, 15, 20 years. Same objectives, expressed in the exact same way. Will this new entity be able to achieve those results? That's going to depend on how innovative, on how creative, and how differently they decide to run the system.
David Levine has years of experience in the healthcare system as a former hospital director, junior health minister, and head of the Montreal Health Agency. He knows what he's talking about when it comes to health reforms.
The Alberta situation, for example, where they tried to create a Santé Alberta, after a number of years, they had to undo it because it wasn't able to achieve the objectives.
Mathilde Lavoie is at the head of the federation representing medical students. She's watching the evolution of Santé Québec closely.
We are hopeful, but we don't want to think that it's just another big reform for nothing.
One aspect she'll be looking at: how Santé Québec will deal with the role of the private sector.
So we don't want to see an increase in the private sector with Santé Québec. But of course, if it's more efficient and if the public sector is really have overall better conditions, then it will be really something to look forward as future doctors.
Christian Dubé has often pointed to the COVID-19 vaccination operation during the pandemic as a model of efficiency. And he says it should serve as a reference for Santé Québec. With 2 years before the next election, there is a lot of pressure to produce results.